Well, Dr. Olukayode Oguntimehin joins us now. He's the Permanent Secretary, Primary Healthcare Board, Ministry of Health in Lagos. Thank you for coming on this morning.
Thank you. Good morning.
And it's good news, actually. He learned that 4 more victims have been discharged. Tell us about this.
What has really happened is that about 5 patients in the last 5 days really have had no symptoms. They're free, they're eating, they're walking around. But part of the protocol that lets you discharge somebody is, even though clinically they're well, you need to do a blood test to make sure that they are viral negative. And that's what we did. And when the results came out, we now announced that they're free to go. The thing about Ebola is this. I think we've had so much panic and misinformation out there. There is usually a natural history about this. And that is, look, out of every 5 people that really get infected, 1 will survive, whether you do anything or you don't do anything. And I think that is where the statistics that says up to 90% die comes from. But if you bring them in early and you do what is right for them, reduce pain, give back fluids, give back electrolytes, give them good food and nutrition, they will usually survive. We know that 2 out of 3 people that usually come in for early treatment do survive this. So the statistics is actually skewed more towards people who will survive than people who will not. I think the experience basically has been that where these outbreaks have occurred have been rural areas that are underaware. And so the first wave and probably second wave have so much mortality. By the time people realize what is happening and they start fighting it, then the mortality rate reduces. What has happened in Lagos State basically is that we were aware from what they want, what we had. We had facilities to try and contain this, and everybody had worked around the clock to try and make sure this has happened. And I'm sure that's part of what, in quote, our limited success story has been, because we are so sad that we've actually lost 4 people.
Yeah. What is this about 3 new cases as 4 more victims are discharged? Do we have 3 more cases? Have more people been confirmed with the virus?
No. I think, again, some of our press people should try as much as possible to get more information before they go out. What we normally do is this. Anybody who's on the contact list, we monitor them. They have thermometers. We go to see them. As soon as they pick up a fever, we bring them in. And then we test. When we now have a confirmation, then we pull them in as a case. But because we're pulling them in is basically for assurance that if this person actually has Ebola, it's not right out there. So, again, like I said, I think our press should actually ask for more information, because this causes...
No, we don't know whether this is in Lagos, because what we're saying, if you look at the rider to that paper, you have 3 persons quarantined in Makurdi. Are you also keeping a tab as to what is happening across the country?
Yes, there's nobody that has been quarantined or has been suspected all over Nigeria right now that has tested positive for Ebola. I always try to let people realize this, that Ebola is not endogenous with us. It is not here. Somebody brought it in. And all the cases that we've had has actually been traced to that one single person. So it is not as if it is there and people are picking it up. No. But because we have this situation in which the symptoms are same way as a lot of other symptoms of other infectious diseases, everybody that has a fever, vomiting, and diarrhea is adjudged to have Ebola. There are cholera cases up north, which we know it's happening, And so you tend to say somebody who's vomiting and has diarrhea and has fever.
We heard that in that report.
Yes.
Nasarawa State did
Yes.
say that what they did spot were, what they call them minor cases of cholera, but it's cholera
It's
anyway.
cholera.
So they share symptoms with other diseases.
With other diseases, yes.
Now, but also, we would also like some clarification as to what transpired with the Enugu case. The nurse who we heard went to Enugu. Excuse me. Is she the one who's confirmed dead now, or is it another nurse?
I can happily tell you right here that the nurse that went to Enugu was discharged yesterday.
Oh, she was one of those
Yes,
discharged.
she was one of those that was discharged yesterday. The issue was basically that when we picked her up as a contact, we were monitoring her. She had to go to Enugu for whatever reasons known to her. But as soon as she started having a fever, she reported in. And a team was drafted from Lagos with 2 ambulances to go and pick her up. And we traced our contacts in Enugu, and we realized that by the time she started having fever, she'd had 6 contacts, which are being actually followed up. And we brought her back in here, and we started treating her. Again, that actually reiterates the fact that if you come in early enough for treatment, you stand a very good chance of getting out of this illness alive.
You said something earlier about the monitoring and surveillance on those suspected to have contacted Ebola virus carrying patients and all of that. There's this fear out there that they're not really being monitored, that it's done via phone, and sometimes nobody goes to see these people one-on-one on a daily basis. You see that whether they're using their thermometers and all of that. Is that true?
That's not true. The Lagos primary healthcare system has a decentralized, how do I put it now, organization. At every local government, there are medical officers of health. There are disease notification and surveillance officers. There are health educators. I can assure you that as of now, I have close to almost between 70 to 80 of the staff of the primary health care board actually following up these patients. So it is not that alone we wait for phone calls. The epidemiological team at the EOC goes out every day. They are divided into about a team of about 6, going about in vehicles, trying to actually talk to these contacts, trace them, because some of them actually need psychosocial support. So you need to actually be in touch with them. Everybody knows this is a scary illness or disease. And so you need to actually assure them that if anything happens, they need to let us know that we'll treat them. And for me, what has happened in the last 3 days of actually being able to discharge 5 patients has offered hope, which is what we do. We want to let people know that in the facility, what we do is actually offer hope. If we put you in the facility and nobody survives, then we have this thing at the back of our mind that, look, even if I go there, I'm not going to get out of this place alive. And we try to seek alternative means of treatment. Now that people do know that we can actually get people out of there alive, it behoves them to actually tell us as soon as they are ill. I can assure you they are being followed. They are not only relying on phone calls from the contacts.